What's up, y'all? This is Dr. Lindsey Matthews, Can Too. This is episode number 262 of the BIRTHFIT podcast. This episode is titled 10 Things I would share with you if I knew I wasn't going to hurt your feelings. Birth edition. This was like a trendy thing going on in the social media world last fall. And I put it out on social media, and I think it's relevant. I think it's still so relevant that we need to talk about it here on the podcast. So, number one, birth is not inherently painful. I think we need to talk about it here because I can elaborate a bit on some of these. So, pain perception in birth varies greatly and can be significantly influenced by preparation, environment, and mindset. As mammals, we are inherently taught to fear two things when we're born. I mean, we're not taught, like they're ingrained, like they're innate with us. We fear two things only. And those two things are falling and loud noises. Therefore, pain associated with birth is a learned fear. It's pretty wild, huh? Like pain is a learned fear that is associated with birth. Many women report manageable sensations rather than unbearable pain, especially when they have had preparation and support. Cultural expectations and fears significantly amplify pain perception during labor. And as we talked about in a previous episode titled "Birth is Sacred," if you haven't listened to it, go listen to that. The body produces natural endorphins during labor that act as pain relief when the process is not interrupted. Pretty cool, huh? Okay, so number two, something I would share with you if I knew I wasn't going to hurt your feelings. You're probably checking the boxes and training to out fitness labor, and I put that in quotations, but you need to be training to soften and surrender. Oh God, I know I pissed some people off when I said that, right? Like you can't outwork labor. Y'all, too often I've seen my VIP CrossFitters, workaholics, my excellence on excellence drivers try to out fitness labor. Physical fitness alone does not prepare you for the mental and emotional demands of labor. Birth requires a letting go of control, and trusting in your body's innate wisdom. Trusting in something greater than you. I know it's hard. Practicing relaxation, breathing techniques, mindfulness could be what your body actually needs more than more fitness. Learning to work with and welcome contractions rather than fighting them or trying to avoid them reduces resistance and fear. Okay. Number three, a nuchal cord is not inherently dangerous. Let me repeat that. A nuchal cord is not inherently dangerous. I know some of you were told, good thing I had a cesarean because baby's cord was wrapped around his neck. No. Nuchal cord, aka umbilical cord, around the baby's neck is common and rarely dangerous. A nuchal cord occurs in approximately 20 to 30% of all births. The nuchal cord is designed to be flexible and compress without cutting off blood flow completely. Most babies with a nuchal cord are born healthy without intervention, as the cord can easily be slipped over the baby's head or body during delivery. True cord emergencies are rare and typically involved the provider cutting the cord before the baby was born, as the cord is the baby's lifeline. Let me repeat that. True cord emergencies are actually quite rare. And more often than not, those emergencies involve the provider cutting the cord before the baby was born. No, no. Studies show there's no significant difference in outcomes between babies born with and without a nuchal cord. All right. Number 4. For majority of the women, birthing in the hospital is not saving them. It's crushing their desires. It's literally sabotaging y'all. Hospital protocols often prioritize efficiency and liability over the individual's birth preferences. Like I've told so many of you women out there, I wish your values and preferences mattered to the hospital or even the birth center. But they don't in reality, and you are simply another number. Many routine interventions are performed without clear medical necessity or even based on evidence. The medicalized environment can increase anxiety and interfere with natural labor progression. Time constraints and institutional policies may pressure women into unwanted procedures and interventions. Home births and some birth centers often provide more personalized and woman-centered care. I would just add, like, if you are a first-time mom, second-time mom, whatever, if the thought of not birthing in the hospital has crossed your mind, please entertain that thought. Please look into that some more. Number 5, your choices today reveal your subconscious values and health philosophy. As we birth how we live, women who avoid difficult conversations may struggle to advocate for themselves during labor or prior to labor. Those who seek control in daily life often have difficulty surrendering during birth. Your relationship with adversity and discomfort in everyday situations will most likely reflect how you'll handle labor. Birth preparation mirrors your general approach to challenges and personal growth. And the level of research and preparation you do reveals your commitment to taking responsibility for your experience. Y'all, I literally just was talking to the coach cohort about this. I want mother-led birth experiences. To me, sovereign means mother-led. And this doesn't have to be a free birth. It can be any type of birth experience. But mother-led implies that you've got to take radical responsibility or extreme ownership, whatever phrase you like better. And this starts long before the birth experience. Number 6, a cesarean is a major abdominal surgery that does come with risk that are not often discussed. Recovery time is significantly longer than a vaginal birth. Why? Because it's an abdominal surgery. It's a surgery. Like, I don't know how to say that any more clear, but it is a surgery, y'all. There is a risk of infection, risk of blood clots, adhesions, and those can affect future pregnancies. The way the scar heals can affect future pregnancies. There's an increased likelihood of breathing problems for the baby due to retained lung fluid. Like the innate design, right, of the body and birth and baby is for baby to come out and have the head come out, start molding its head and its face and get that thoracic pump to expel some things. And if it doesn't, then there could be some retained lung fluid. There's higher rates of breastfeeding difficulties and delayed bonding associated with cesarean. And future pregnancies carry risk of uterine rupture and placenta complications. It's not common, but they do carry that risk. Number 7, and y'all, I love all these, but this one might be my favorite, or it might be the one like I'm really most passionate about. Number 7, waiting 5 to 10 minutes to cut the cord is not delayed cord clamping. Delayed cord clamping needs to be hours or days. The cord continues to pulse and transfer blood and stem cells much longer than 5 to 10 minutes. Optimal cord clamping allows the placenta to fully transfer the baby's blood volume, and that blood belongs to the baby. If you cut the cord 5 to 10 minutes less than 30 minutes, you are robbing the baby of their own blood supply. Premature clamping can lead to iron deficiency and anemia in infancy. The cord naturally stops pulsing when the transfer is complete, which can take 20 plus minutes minimum. Many cultures traditionally wait for the placenta to deliver minimum, at least, before cutting the cord. And as y'all know, sometimes the placenta can take a while to be delivered. So I've done some like past life regression therapy stuff, and cutting the cord early always comes up for me. So it pisses me off more than you know when I see a baby robbed of their own blood supply. Okay, number 8, when you make choices for providers or therapists based on insurance, I can almost guarantee you will be disappointed. Y'all, when you make choices that are not, these choices are usually not in alignment with your values. You've only made them out of fear of not having enough money. You've made these choices out of lack, out of scarcity. And every time I've seen it, there's disappointment. Insurance networks often prioritize cost over quality of care. Providers who accept insurance may be rushed and unable to spend adequate time with patients. The best practitioners often operate outside of the insurance systems so that they can maintain their own standards. Investing in your birth experience is worth the financial sacrifice for most families. Insurance-based care often follows a one-size-fits-all protocol rather than individualized approaches. Y'all, my family and I, we are on something called Crowd Health. And if you want to check it out, I will send you a link. Send me a DM on Instagram, go to BIRTHFIT, send me a DM, say, hey, I want to check out Crowd Health, and I'll send you the link. I love it. I love it. I love it. I love it. We were on, but prior to that, we were on Christian Health Ministries, and I loved that too. I just liked the incentives and the what, how do you say it? Like the value system that Crowd Health has. I think it's really in alignment with me and our family. So if you're interested in checking out something other than a standard insurance model, let me know. Number 9, lifting weights should be mandatory. This is another one I'm very passionate about. Minimum twice a week. Strength training builds the physical stamina needed for labor and recovery. Weightlifting improves bone density, which is especially important during pregnancy and breastfeeding. Strong muscles support proper posture and reduce back pain during pregnancy. Resistance training helps maintain muscle mass and metabolism during hormone changes. And the mental discipline of weight training translates to greater confidence during labor. Number 10, you always have a choice. And I would say that even if I knew I was going to hurt your feelings, if I knew I wasn't or was going to hurt your feelings, I will tell you, you always have a choice. Even in emergency situations, you have the right to ask questions and understand your options. You have the right to slow down. You have the right to take a breath. Informed consent means understanding risk, benefits, and alternatives before agreeing to any procedure. You can change providers, birth locations, birth plans at any time during pregnancy. Y'all, no is a full sentence. Saying no to medical interventions is a valid choice that should be respected. Your body, your baby, your choice, regardless of pressure of family, friends, or medical professionals. And let me remind you of this. Your choice, I need you to try those choices on because some of us forget that all choices come with consequences on the other side. So your choice and your consequences are your responsibility. But remember, you always have a choice. I hope you realize that you have the power inside of you. Prepare and educate yourself, then trust your intuition, lean into your God and a deeper knowing. All right, y'all, that's a wrap for this podcast. Please share this with any pregnant mamas you know, and I will talk to y'all soon.